Hi, thank you for joining me. I'm Jeremy Morgan, nurse practitioner at Access Solutions Rheumatology out of Tulsa, Oklahoma. And I'm going to be addressing today the question, what skeletal and dental manifestations might indicate hypophosphatasia, also known as HPP. So dental manifestations, these patients usually have a lot of dental caries. They have had lots of teeth either pulled due to cavities, or they just are constantly getting fillings, having crowns and root canals done. As for the musculoskeletal, these patients complain of foot pain and long bone pain, so pain in the shins. They also complain of enthesitis. So these patients will have a lot of tender spots. Sometimes they are diagnosed as fibromyalgia patients. These patients will have frequent fractures in the feet, but their feet hurt so much all the time that they don't recognize that they've broken a bone in their foot. These patients will complain that they can't stand for more than 10 minutes without their feet or their shins starting to hurt. They tend to be short-statured. The typical presentation that we're all taught is that these patients are bow-legged or knock-kneed or windswept, but that rarely tends to be the case. We see that more in infancy, but not so much in adulthood. These adult patients tend to be short-statured, though, but they typically will complain of joint pain and will typically have osteoporosis or osteopenia, especially diagnosed at a younger age. So these patients will usually end up in pain management or being sent to rheumatology. And one of the interesting things is these patients, if you put them on bisphosphonates, it actually will worsen their osteoporosis and it won't do very well. They will fracture sooner than later on the bisphosphonates. So those are the typical manifestations that we tend to see in the skeletal and in the dental domains of a patient with HPP. And I thank you so much for tuning in to Frequently Asked Questions. Feel free to visit RhAPP Content Room or the RhAPP ACE app for more information on HPP or any other autoimmune disease. Thank you.